Hi everyone, I'm Lauren Dockett from Psychotherapy Networker magazine, and with me today on the split screen is Lynn Lyons. Thank you for joining us, Lynn.
My pleasure. Happy to be here.
Lynn, as some of you may know, specializes in and writes about treating anxious families, and for the current issue of the magazine, has written about what it means to continue to see young adult clients that she'd actually started working with when they were children in family therapy. Lynn, I like this piece for a number of reasons, but specifically because it raises some rather interesting issues about the time span of therapy and also about what young kids, some of them at least, seem to need today. So once upon a time, therapy could be this lifelong psychoanalytic commitment. And then some therapists and then clients themselves wanted to start to be involved in a therapy that was briefer, so called cognitive behavioral interventions, brief therapy. They wanted to just go in, come out, and get on with their lives. And you yourself are a brief therapist. But in this lovely piece of yours, you're looking at how, at least for some of the young people that you see and treated as children, continuing a relationship with them now that they're young adults is making some sense. So can you give us an example as to why this is?
Sure. So, and it's interesting too, because I think that as I've been working with families, this has sort of evolved in my head over time. I'm a big process person. I'm not a content person. And what I have found is that when I work with families and I teach them the process, they get it and then off they go. So I'll see, a 6-year-old for 2 or 3 months, or I'll see an 8-year-old for 6 months. And I don't see people weekly a lot, actually, because I'm just not around all that much. So it could be like brief therapy spread out over 3 months.
Yeah.
But then what I found is that the content will change in terms of their anxiety, and that throws them. So they understood how to manage anxiety as an elementary school kid or as a middle school kid, but now there's this new content of sort of they're in a relationship or they're trying to get a job or they're heading off to college, and they just need a little booster on the process. So what I have found is that if I keep that relationship open, they come back and see me for a little bit of a booster, that it really just becomes kind of an addendum to what we've done in the past. I'm not starting over, right. And it's not this whole new problem. Mm-hmm. And the other thing I started thinking about too, and it probably has to do with, not coincidentally, the age of my own kids, because I have a 20-year-old and an 18-year-old, okay. And I don't feel like I'm done parenting them, and I think that sort of works into my thinking a little bit, is that it is very valuable for all of us to have some sort of ongoing connection, that you can come back and you don't have to reintroduce yourself. You don't have to start over. They come in my office. Sometimes they're a foot taller, and I go, "Oh my gosh, you're so big," right? And then boom, we can get right into it. So even though it's this long relationship, there is this immediacy where we can just start talking skills and strategies right away.
Great. Yeah.
My dentist didn't make me terminate with him, and my massage therapist I've had since my kids were babies, and I'm thinking, it just, when I go in to see my massage therapist, I don't have to re-explain why my hip hurts.
Right.
It's where we left off. So
yeah.
That's why it's evolved that way.
That makes so much sense. Now, some of the cases that you talk about in your story, these kids they're in a transition period, right? They're heading off to college. It's not working, or something else that's happening. Is there something specific to kids these days where they're having this trouble with transitioning to adulthood? And what are you working on with them to sort of solidify that transition?
Yeah, I think there is something about kids today. I just think they haven't had a lot of practice a lot of the time.
Okay.
And so when I meet with families a lot and they're little, and I work on trying to increase their autonomy, increase their problem solving, a lot of these kids come back, and if we look at it sort of realistically through high school, they haven't had a lot of practice. Parents have been very involved in the college application progress, or they've been very involved in their social life or their scheduling. And so when they're going off to college, this feels like they are like jumping off a cliff. It hasn't been as gradual, I think, as it has in the past, that you're sort of working your way into it. A lot of them haven't had really demanding jobs or other things. They've been really sort of in this routine of being a kid and then being a teenager. And so adulthood seems like, and young adulthood and independence seems like a completely different thing.
Yeah.
Their parents are still tracking them on their cell phone when they're going to college, and being able. So I think that there's such a connection. I think technology has made that very easy.
Yeah.
To endure, and so I think maybe that's why there's it doesn't feel like a gradual thing. It feels like more like oh my God, now I have to go and be an adult and I have no training.
Yeah. So are you having to do a little bit of that training for them, with them? Yeah.
Yeah.
Okay.
Absolutely.
Yeah.
Yeah. And just managing sort of the things that, we learn by experience and we learn by mistakes. And a lot of these kids haven't had that much opportunity to make any really big mistakes. Nobody's been fired from a job. Nobody's been, so really they come back as young adults. And I mean, the fact that they call it adulting, I think, is kind of indicative of the fact is that they see it as something completely separate from teenagering.
Right, exactly. Well, finally, can you envision them, kind of like you and your massage therapist, can you envision them coming back to your office as they continue to age? And can you really still be a brief therapist when you have this potentially lifelong relationship with the client? Are you going to revoke your brief therapy card?
Right. There has to be some other term. I haven't come up with it yet. But I have a client that I see now who I met her when she was 11. Okay. And she was, adorable, and there was a lot of anxiety and that kind of stuff, and I worked with her. I think maybe she came back when she was in college a few times, but now she is about to be married. She is, working on her career. She's still dealing with the same family issues she was dealing with before, but now from this adult perspective, and trying to redefine her role as the baby in the family. And so I've known her now for 18 years or something like that. So I can imagine that. It's actually pretty gratifying to me. I really enjoy that role that I have. So I don't know. I mean, I think of brief therapy as sort of more an orientation of how we go at the problem. And so there's got to be some term we've got to come up with that it's brief therapy over decades, right, which sounds so contradictory, but and maybe solution focus is a better way to talk about it.
Okay.
Because every time they come in for a different chapter, I'm still going to use that same approach of sort of like, what's the target and what are we going after here? Yeah. And what are the skills that I need to teach you? Yeah. So maybe a skill-based solution-focused therapy who sees kids in chunks of time as they become adult, but I can't think of anybody that I've seen, every month or every week for 20 years.
Right. Yeah.
But I can absolutely imagine it. And this one person comes to mind that I'm doing it.
Yeah.
So.
Yeah. And you welcome it, it sounds like.
Yeah. It's really nice to have these relationships with families too. I see the family sort of move through.
Yeah.
I think I said that in the article, sort of like the town doctor.
Right. Yeah. That's the relationship. Thank you, Lynn, so much. Everyone, do check out this article in the current issue of the magazine. It's called Bumps in the Road, Accompanying Your Clients Through Life's Transitions. Always a pleasure to talk to you, Lynn. Thank you.
Thanks for having me.